Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. Today, we've got a big podcast today, Dr. Rovelo.
We do, but we shouldn't pick on our guests and say mean things like that.
Ouch.
It's already starting.
Inappropriately sized.
I'm just saying, there it is. Dr. Rovelo, you're doing good?
I'm doing well.
Are you ready for this podcast?
I
It's a
am.
download on a whole year of fellowship experience from our two fellows, Dr. Xiao Zhu, which I'm saying
You
it
guys are
correctly
perfect.
now. It's taken me some time.
taken a year.
That is spot
You
on.
got it.
I'm impressed.
And Dr. Jenny Hillary.
No.
Oh, no, you messed it up.
No, from Dr. Hillary, Jenny. No, we were doing it before,
No, we got it.
and we were saying how everybody goes, what's Jenny going to do? I was like, Jenny, my coordinator? No, Jenny, Hillary. It's Hillary Jenny. It's Jenny Hillary. I don't even know anymore.
Very confusing.
It's very confusing. So you guys are doing well?
Yeah, just great.
Doing awesome.
Survived the fellowship.
Yep.
Just a little time left. There's still time to fail out. Don't worry. We could still, no, I'm just kidding.
I'll try my best.
Yeah, no, I think you guys have
We'll
made
stay
it.
on it.
Great year. We want to hear about it. We want to talk about it because we had you on early on.
Yeah.
And you guys were bright-eyed and bushy-tailed with lots of expectations. We want to kind of hear, did it work out? Was this worth it's a whole year that you could have been practicing somewhere in doing, taking your residency, not learned anything else that you needed to. So tell us just one by one, was it worth it?
Resounding
Jenny.
yes. Resounding yes.
Yes.
I think, it's a year we could have done other things, sure, but I think what we would have been doing would have been struggling immensely with a huge, huge, huge learning curve, steep learning curve, trying to figure things out on our own. And I think we talked about this a little bit in the first one. We could have gone off on our own. It would have been fine. We would have figured it out, but we both want to be great. And I think this year has really given us the opportunity to learn what we wanted to do, both clinically and from a practice management standpoint, to actually go out and, try to be great from day one instead of going out and trying to struggle. We'll still have to figure things out, I'm sure, but I think the learning curve will be a lot more pleasant.
Xiao?
Yeah, honestly, it feels like, I swear, it was just yesterday we were on this podcast, and it has flown, so fast.
It's quick.
But yeah, Hillary hit it on the nail. It was, we would have been perfectly fine out of residency, going into practice, doing our thing, but you don't realize what's out there and how other people do things until you're exposed to it, until you're scrubbing with somebody and really learning the nuances of how the masters do it, especially here in Beverly Hills and Los Angeles. So the techniques that I've learned, man, those are the things that I never would have gotten, never would have thought that I would have kind of understood and gotten the hang of, and those are things that I'm going to take with me to the next steps, and those are the procedures that I'm going to be doing on my patients. So
Yeah. And just as a little background preface, you work with probably how many? 8 different plastic surgeons in town. There's a fair amount, and you go to different facilities. So not only do you see different parts of the city, different surgeons, you learn different techniques and see different ways that everybody does things. So you get really a wide breadth, not only of different surgeries to see, but also different surgeons and the way they do them.
yeah, exactly. And there's a lot of different ways to do something, right? And you're not. We're gonna pick and choose kind of the things that mesh with our skill set and with our hands, and we gotta get to pick and choose what we want to do for future, practically for rhinoplasties and facelifts and things like that. And we're probably gonna do a mishmash of all of our techniques.
Definitely. I think for each surgery, one of the main things I'd wanted to learn was really great techniques for every single surgery that I want to do. And I think when I think about my version of all these different things, that it's I want to do how they do progressive tension sutures, and I want to do how they do the belly button, and I like this dissection of the nose, but I don't really like that. I like that one, and it's kind of an amalgam of everybody that we've learned from, and so that's been really fun. And I think the other thing I didn't really appreciate the importance of until this year was getting able to see how every single person intraoperatively problem solves, because you can know lots of great techniques and have a really good plan going in, but oftentimes the surgery is not going to go exactly as you predicted, especially if you're dealing with a revision or a quad revision. You get in there sometimes and it's absolute chaos. And you have to make sense out of that chaos and make order out of it. And I think that seeing how different people problem solve when they're okay, this breast isn't looking like how I want it to look, this nose isn't looking how I want it to look, how do I fix this? That's been really invaluable.
That's a really good point. Everybody does have their troubleshooter chart that, you go through when you're banging up against a problem. You got to figure out, all right, this isn't going the way I want it to. And, people think that every operation is just, it's a piece of cake. It's not at all, especially facelifts with threads that were placed that they forgot to tell you about, and fillers that show up and wreck the day.
Surprise.
And, always. So, that's a very good point. So what was sort of the highlight of the fellowship for each of you from just even from like, never mind even the surgery, like what is it that happened that you were just like, I didn't expect I was going to get this out of the fellowship?
I guess I didn't expect it's such a well-rounded experience, literally from head to toe. Coming in here, I knew it was a very
Did you
rhino.
do toe surgery?
Maybe not toe.
Okay, all
close
right,
though.
good.
We did some ankles.
Yeah.
Some cankles. Yeah,
Definitely
some cankle
ankles.
liposuction.
Yeah, cankles we do.
We did some of those.
Yeah. Those
ankle.
tree trunks need to be beaten back. We can do that for you.
But coming out, I knew it was going to be a very strong rhinoplasty program with the surgeons that are in the practice. But everything, face, nose, brows, eyes, lips, breasts, tummy, everything was something that we got great exposure to throughout the year. And that was something that was truly amazing. There's other fellowships out there that are, they're very strong on one thing and maybe not so strong on something else. And this fellowship, I think, is an exception to that.
No, well, that's good.
Yeah. You know what I think is interesting? Because we do these fellowship interviews every year, and we always ask the fellows or prospective fellows that are applying, like, why this fellowship? Like, why do you want to come here? And almost routinely across the board, they say, well, I want more face and nose experience, because that's usually not what residents get in their training. And so they always say, well, this fellowship is very face and nose heavy, and that's why I want to do this fellowship. So it's interesting to hear you say that, like, well, yes, obviously you do a ton of that, but it's way more than that.
Oh, yeah.
Too.
Way more than that. But a lot of breasts, a lot of body, a lot of everything.
Right. So it's not just, here.
That's everything. I would totally agree with that. I was thinking back on like the procedures that I really wanted to learn about. Yeah, it was like face, nose, and then complex breast revision, which definitely got that. I had a really tough case just out today. Tough breast revision. And I was like, I could not have done this case coming out of residency in the way that I did it now. And so realizing that, I think with breast, the more you learn about breast and complex breast, the more you realize the more there is to learn.
The more you realize how complex it is.
How complex it is. So it's just a never ending puzzle, but I think I'm at least several chapters beyond where I started. And so that's been great. But like even liposuction, I mean, I think we all leave residency thinking we know how to liposuction, and you can definitely suck fat. But really good liposuction and how to handle somebody who's had bad liposuction and redo it without making it worse, and all these different techniques. I mean, I know how to look at a butt now and tell you what's wrong with it or what's suboptimal, where it needs fat, where it doesn't. And like we don't do BBLs in residencies, and so it's stuff like that I didn't necessarily come here saying that's going to be my focus, but I feel like I've had so much of a more well-rounded experience than I could have ever anticipated, and it makes me feel a lot more confident going into practice that I can solve a wide range of issues.
Yeah. I mean, we're still very, very early in our careers.
Yeah.
But I think the confidence that both of us have gained throughout this past year is invaluable. The breadth of cases that we've seen, the challenges that we've seen our attendings go through, because like you said, Doctor, surgery is not straightforward, right? You get like a tertiary quad revision, whatever. It's just a ball of a scar that you have to meander your way through to make sure you're still in the right plane, dissection plane.
It's good to be in the right plane.
It is. It is. They say when you're in the right plane,
I know.
they're better, right?
You're going to find your results are going to improve when you stay in the right plane.
But the confidence shift from the first day we started fellowship to now is that'll take us far.
Yeah, learning how to deal with complications, that's a good one, because obviously we all have complications, and knowing how to manage them, that's really helpful to see how Dr. Calvert manages like wonky healing in a rhinoplasty, or how someone else manages like a wonky breast or something like that, I think, and how they deal with the patients, right? Like how they manage the patients.
Yeah.
So I guess on that vein, I would ask you best and worst cases, and maybe the best one's also the worst one, and the worst one the best one.
I can speak to a personal experience. I had a fellow's case 2 weeks ago. It was a butt implant case. It was.
You were putting in the implant?
I was putting in an implant for a patient who just really wanted butt implants.
Who doesn't?
I guess. I mean, I can't say I've woken up and really wanted butt implants.
I'm joking.
But the case went fine. The patient is ecstatic with the results. The dissection was not great. It was an intramuscular dissection, and it's a tough surgery.
It is. It is a tough operation.
Yeah.
That butt implants are something that I think you should do a lot of them if you're going to do them.
Yeah.
I don't do a ton of those, but every once in a while I have a patient's like, "Can you do this for me?" And I'm like, let me think it over, because it's never like something that's high on my radar.
It's a high complication rate too.
Right.
You're putting an implant next to a dirty area. You're at risk.
A lot of risks.
Yeah.
It's a shitty neighborhood.
Yeah, I think so.
The neighbors are kind of an a-holes.
I would say so.
Yeah, totally. Well, I mean, but did you?
So was that the best or the worst case?
Is that the worst case? Worst case, best case? Is that your best case?
Both.
Well, maybe a little bit of both.
All right,
Yeah.
cool.
I mean, you learn, right? You're not going to learn unless you step outside your comfort zone. So that was kind of a scenario where I forced myself to step outside my comfort zone and learn to do a surgery that I otherwise probably would never have exposure to. So.
Yeah. Yep. Dr. Jenny?
This is hard. I think my worst case was probably the first BBL that I tried to do, because I realized just how much I had to learn, and it was pretty early on in the fellowship, and I was like, wow, it turned out great. The patient was very happy, but my own stress level, I was like, here is a point that I want to work on, because I want to feel a lot more comfortable with this, and I think I'm now at a point where I feel a lot more comfortable with that. So that's been good, but it's a growing point when you feel that. Best case, I feel like I like all of my cases, so it's kind of hard to pick. I've been really happy with a few of my mommy makeovers, because the patients have been just ecstatic, and the way that they've explained to me how it's changed their life and their confidence has been really moving and helpful. I think a lot of them have felt like it's really changed how they interact with the world, and so that's been really, really meaningful. So I think those are maybe some of my best.
Yeah, the theme of butts in our
in this rhinoplasty fellowship.
Theme of butts. So, yeah.
I don't know. It is an important part. You do come. I know that people do, when they look at this fellowship, they're like, oh, all these attendings do so much face and rhinoplasty. And, to that note, I mean, like, how many facelifts would you say that you guys, either did on your own or were involved in a meaningful manner? I mean, is it in the 30s, the 50s, the 80s?
100.
Yeah,
100.
Probably close to that.
100 facelifts.
Yeah.
Probably close to that.
And usually that's like full face, and so it's
Right.
oftentimes it's with a brow or a
Ancillary
quad cleft
pieces,
or lip lift, other things, facial
Right.
fat grafting.
The whole
so
deal.
the whole shebang. Yeah. Everything they need.
And how many rhinoplasties did you think you got? I mean,
More than 100, several hundred, couple
I
hundred.
couldn't even count.
do you think? You think it's a couple hundred?
Well, I was trying to
Well,
think.
you're going to need to count, because we got to report
Yeah,
this.
yeah, I know.
I'm
I was
looking
saying we have
back.
to look back on it.
I should have.
I think that's
Something in the triple digits, probably.
well into the triple digits, more than 100, maybe close to 200.
Yeah, I think it sounded
It's up
as
there.
I was paying attention to your guys' schedules, it sounded like you're probably well into the 125 to 175
Yeah.
range, if not near the 200 range.
Yeah,
It's a lot.
I would
But that's
say.
a lot,
It's a lot.
that you're involved in
It's a
or
lot.
have done. I know you've done a bunch of your own fellow cases, which is great.
Yeah. A lot more coming up too.
Yeah, it's going to be
Yeah,
end
it's
of
not
the
over
year
yet.
with
Friday,
the
don't
with
We
the
have one
bang.
on Friday. Yeah, we have one on
that'll
Friday.
be a doozy.
It's gonna be good.
Easy
That
case.
you know
Easy
that
case.
I'm glad I'm going to be in Vegas for that. Actually,
We're gonna have so much fun.
FaceTime
so
you.
Dr. Jenny presented that case to me, and I was like, that looks like Dr. Rovelo needs to help with this one.
It's like I think we can do
This
it.
isn't exactly my
can help
cup
this
of
patient.
tea. Really.
Definitely help her.
Yeah.
No, you guys will
Yeah.
make it better.
I'm
You
excited
have the
about
right.
that.
You have the right attending.
Yeah.
Of course, it's listed on my schedule, so everyone's like, "What are you doing on this patient?" I go, "I'm hiding under the sofa. What are you doing? I'm not doing the case.
Fleeing the
This is get that
Literally.
name off of there. Like that is for Dr. That is the dynamic duo of Dr. Jenny and Dr. Rovelo, and I will be in Vegas talking about rhinoplasty, as a matter of fact. So that's safe for me. I'm good there. In terms of your techniques that shocked and surprised you, we hear so much in the media now about the deep plane facelift. I always explain to people this is something that I did my first one by accident as a resident. You know, when I realized that the mask was so thin, I was actually in the deep plane.
You weren't in the right plane.
I was in the right plane.
Actually, you were.
It turns out
Accidentally.
But it was Futrell was the attending, and he wanted me to do a SMAS placation, and this lady's SMAS was just really thin for whatever reason, and I was under it, and then I'm looking at the facial nerves, and I was like, oh, I'm in the deep plane. And I had read Tord Skoog's book. Yeah. And so this isn't like, I just for everybody who's listening, this wasn't invented by the surgeons of today who have claimed that they own this technique and that they made it up and it's theirs and they've named it and rebranded. And all. It's not. It was like in the 70s that people like really developed this. And it was Vladimir Mitz and then Tord Skoog and Peyroni. These were the people that really came up with this technique. With that said, like, what came out of it for you? Because you guys weren't really doing deep plane facelifts where you came from in your other institutions.
We did a high SMAS dual plane, but I would say my comfort level with the deep plane has risen immensely. I think I had a lot of trepidation and a lot of fear about the deep plane. Like I wanted to be in the deep plane, but I was afraid of it. And now I feel comfortable and I have a healthy respect for the deep plane, but I feel very comfortable navigating its waters. So that's been really fun.
And the results
are awesome.
They're great. Awesome. Speak for themselves.
It's the best, right? So with all the media attention on it, how will you navigate that when you go to your new practices? And where are you going? You can tell the
Yeah, you guys were you're very secretive in the beginning. So now do we get the big reveal as to what you're doing?
Can you reveal yet? Or has everything signed? Or, if it hasn't
She signed yesterday.
Ooh,
so, yes. Thank you. It feels really great. I will be joining Congressional Plastic Surgery in Northern Virginia. So for any East Coast patients who are listening, they can come see me there. Yay. I will be there.
I didn't know Congress had a plastic surgery practice. That's interesting. I'm just kidding.
No comment.
It is bipartisan. Yeah. Welcome all.
Very good. Very good.
So I'll be there.
And you're located in what city?
It's in sort of Tyson's Corner, Vienna, Virginia. So.
Wow. That's very cool.
And it's a purely aesthetic practice?
Purely aesthetic practice. I'll be doing everything head to ankle.
Head to ankle.
No toes?
No toes, sure? Yeah. Unless there's a really big problem with the toe. Maybe I can handle it. But.
I was on a Tyra Banks episode one time where I forget the model came out and said she wanted toe liposuction. And Tyra asked me to comment from, the in-audience expert.
Yes. Oh.
And I was just, I think that got me banned from the show. I'm pretty sure I said something like, this is absolutely ridiculous. And I can't believe I'm wasting my time here today. So.
Sounds about right.
Xiao, can you talk about it? Or
yeah, sure. Almost. Ink is not dry yet, but very
close.
99% sure we're going back to Pittsburgh, Pennsylvania, which is my neck of the woods.
There you go.
Yours for a period of time too.
I feel like it's my emotional home. And that's I love Pittsburgh. Yeah. I mean, I was just there.
Yeah,
recently.
both of us were just there.
It was great. We did a cadaver course.
Yeah.
And it was awesome. We did a big rhinoplasty course. Went to a Penguins game. You missed out on that, though. That was too bad. But it was really good. It was great to see everybody. That program is doing great. It's great. You'll be in Pittsburgh. Oh, yeah. It's a different practice environment there. A little bit. I hung around with Guy Stoffman, who's one of our good buddies, and ran into a bunch of young plastic surgeons in Pittsburgh trying to make their way. And of course, ran into Ted Lazaro, who, runs
old school,
Estique, which is, I guess, out towards Greensburg or something. Yeah. And it's very interesting. Pittsburgh has a unique practice situation. I was just like, where do you guys get aesthetic patients out here? But I think there's a lot of body contouring. Yeah. I don't know how much facelifting there is for you there, but there's more and more.
There's a good amount.
There are old people there.
Yeah, there are. This
Where
is
there
true.
are old people, there are facelifts.
Fun fact. The most aged population in the summer is Allegheny County.
Really?
And in the winter, it's Broward County in Miami. And there's a snowbird effect.
Makes sense.
It's like an East Coast phenomenon, not the West Coast, but on the East Coast. Like Allegheny County has the oldest people in the summer.
Maybe I should split my time half and half.
Yeah.
Maybe you should do your facelift billboards in the summer.
Yeah.
Well, I would love a retirement plan of Pittsburgh and Miami, but I'm stuck here for
taxes are a little bit better out east. Just a little bit.
Way better. I mean, as long as Florida's 6 months in a day, I'll be happy. But I've got a few more kids to get through college and high school here in California, so
we do more work to do.
So Pittsburgh and Tyson's Corner in Virginia.
Vienna.
So that's gonna be great. And you guys would be jumping right in right away, right?
Yeah, I hope so.
Yeah, July 23rd.
Wow, that's
I know.
literally jumping right in.
I pushed to get it as early as I could. I'm that excited.
Oh, that's great.
That's great. Yeah.
I want to get going.
While you're fresh and everything's in your head,
I'm motivated.
might as well. Yeah. I think that's good.
And what other lessons did you take from the fellowship? You know, I mean, there's a lot of, other than some, corny jokes from the Roxbury, clinic and surgery center. I'm sure there are plenty of corny jokes.
You will take those back. I guarantee.
Yes,
You'll be in the OR and you'll be telling.
Unfortunately.
Yeah, that's true.
Yeah, I would say lessons learned. Maybe what advice would you give to the incoming fellows for their upcoming year?
I think for my patients, post-op, just patience, waiting, right? A lot of patients will complain about, asymmetries here or there that they see literally a week out where they're like maximally swollen. And then you get a little nervous as a surgeon, right? You want things to be perfect, like as they were when they left the OR, and then swelling happens. They sleep on one side of their face or the other, and then one side gets asymmetric than the other. And I think just learning patience to be able to impart that on the patient as well, that it's a hurry up and wait kind of game for all surgeries,
and that
big or
is
small.
so hard, not just for the patient but for the surgeon, especially when you're not as familiar with the procedures and the typical post-op course. It can be stressful for the surgeon too. But I think that's great advice. Patience.
I think paying attention to how your results age over time, or how the faculty or with how their results age over time, and trying to be as involved in clinic as possible is really helpful, because I think in residency we were like, oh, that'll settle out, or this will fall, that'll drop, but you don't actually know how much. Yeah, and you're like, I mean, I hope so, but
That's what they say.
That's what they say, right?
Hey, I think it'll be all right.
We did not do a lot of clinic in residency, so that was like what we all joked. But I think trying to pay attention to that and hopping in clinic as much as you can to really learn that, as well as learning it from your own patients. I think that's really helpful.
Yeah, I mean, I think that's really key. Who of all the attendings, and this isn't a popularity contest, but just who gave you the greatest pearl that you think, like, God, this was something I hang my hat on it all the time. I hear this in my head, and it's that you it could be, it doesn't even have to be one of the surgeons. It could be like one of the nurses or techs or one of the PAs or something. What's the
voice in the head?
Yeah, that thing that you said, boy, that's so it. Like, I needed that. What's that one thing that, like, you can kind of say, I'm glad I got this out of the fellowship?
There's so many different things. I feel like when I'm in different stages of different procedures, I hear different people telling me how to do different things. And so I feel like I have like 8 different people on my shoulder at any point in time, depending on what I'm doing, who are like, you should do it this way. Look at that. Have you thought about that? And I feel like I think,
like, stop, quiet, stop.
But it's usually helpful. It's usually helpful. But I think just having a sense of, like, you want it to look the way you want it to look when you leave the operating room. And I think being really critical of yourself, and I think our faculty do a really good job of being critical of us without being, like, demeaning or demoralizing. Mm-hmm. And I think that is what you need in training to really see, this could be better there, this could be better there. I didn't quite hit the mark here. Maybe go back and change that a little bit, and not leaving until you're really satisfied. I think that's really important.
That's a huge point.
I like that one. Yeah.
I mean, we can be more demeaning and demoralizing.
No, I'm very happy with the blend.
Okay.
Balance is good.
It's a good mix.
We can turn it up.
Yeah, but I think that perfectionist eye, the, like, not settling for good enough, I think that's a huge, I mean, you can't leave the Los Angeles Aesthetic Surgery Fellowship with good enough. Yeah, it has to be excellent.
Yeah, good enough is not good enough.
No, it's not. Yeah.
That's a pit tagline, isn't it? The get it done, good enough isn't.
Yep.
Yeah.
Good guy. That was it.
That
it's
is,
GID, GEI. It's
another
all over. That is like a pervasive part of the pit culture is get it done, good enough isn't. And it's the truth. You really have to leave the OR thinking, okay, I've done everything I can. This is as good as it can be today. I've gotten everything I want out of this, because that's the best it can be. The healing process can only make things worse for you. So you got to nail it in the OR. That's a great point. Yeah. Xiao, what's yours?
I mean, kind of the same. I think just having, like, a little person on my shoulder, just in terms of inside the OR, telling me to slow down where I need to slow down, right, during critical parts of the case, or get quicker where we know where the dissection plane is going to take you, where there's not things that I can injure, and that just moves the case along and efficiency.
There's something about a rhythm to the operating room, isn't there? There's a tempo. Yeah, there's a certain tempo to surgery. I mean, there's so much to it, and it is interesting that when you feel that tempo working for you, the operation just moves along, and when you're having trouble, like it works against you. It really does. I mean, there are operations that just are, and I find this in revision rhinoplasty because I do a lot of it, but the revision rhinoplasty that fights you while you're doing it is really, really difficult. The nose is just, it's like you're just working in, like every once in a while a little fist comes up. You're like, I'm just trying to fix you. And it's like, no, like I'm not going to do this. This is going to be concrete. You're not going to dissect this. The skin is so thick, forget it. This is going to suck and we're going to make it miserable. But that happens, right? Yeah. And you have to be able to know how to deal with those things, which you have both, I'm sure, gotten a massive experience in how to do that.
Absolutely.
That's good. Yeah. Any other notes that you would impart to the next incoming fellows fellows are coming from Pittsburgh and Yale? So another Pittsburgher.
Another pity, yeah.
I know. It's very interesting. She should do great. And then our other fellow from Yale University, which is not terrible. So, we don't pick them based on their institution. We pick them based on the best. Okay. And I'll tell you a quick story because when I was back at Pittsburgh, were you there on that conversation with the residents?
I think so. Yeah.
Remember when they said, like, how do you guys have such diversity in your fellowship? And, like one of the residents.
What does that even mean?
We always joke that we were the DEI. We have a female and an Asian.
Yeah.
Diversity, like in ethnicities
so they say
and gender,
to me. So this is, by the way,
it's true.
Okay, first of all, it's me. Okay, so they're gonna like hit me with this one.
Like, what are you guys supposed to be? I'm so okay. Carry on.
All right, so they go, God, I commend you on the diversity of your fellows. It's just amazing how have you gotten such incredible diversity? And I thought for a minute, and I sat there, and Futrell was in the back, and I said, I would argue that we have absolutely no diversity. I said, we don't have any diversity whatsoever because all we've ever done was try to pick the best candidates for this fellowship. And we don't care if they're purple, brown, green, yellow, upside down, 3 legs, 12 heads, 2 heads, wings, doesn't matter. We've picked people based on having the best opportunity to train the best fellows. And she just looked at me like kind of like,
that's not the right answer.
That's not what I wanted to hear. And I was like, no, there's no diversity.
What are you going to say? Every 4th year, we try and pick a girl.
Yeah.
What, are you supposed to have a quota?
We don't have any kind of.
This is the female and Asian year.
It's 2 spots. But it is. It's 2 spots. Like you can't possibly pick based on anything other than we want the best candidates. And that is how we have chosen our people. And have we gotten diversity? I don't know. I guess so. I think that's great. But I've really been very proud of us for picking people that are just incredibly awesome surgeons, as both of you are. And you will go on. You will make us very proud, I'm sure. And you'll make your patients happy, and you will be satisfied because the education that you pull out of this fellowship will make you better. Not just for your patients, but for yourselves in terms of your ability to problem solve, to make things, to learn as you go. And I think you both, I don't know what you learned from me, but I hope that you learned from me that during the operation is the best opportunity to learn and to be better.
Yes.
Like while you're operating, while you're doing it, this is your opportunity to create and be better. And I think that's why, you'll get better and better as you go on. And as the fellows who've finished this fellowship have, before you, they're doing great.
They're killing it.
They're doing great. They're doing amazing work. Couldn't be prouder. And so I'm very happy for both of you.
Thank you.
I just think, it's a big congratulations, and it's a real opportunity to go out and just be amazing at what you do, which is kind of the whole goal of the fellowship, isn't it?
Goal. Yeah.
Dr. Rovelo, any comments on that at all?
Nope. I just wish you guys all the best, and we've enjoyed having you.
Thank you.
Thank you so much.
Well, with that said, then, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.